Care Queen Brenda here. There are many things that can cause terminal agitation or severe anxiety. We don't know exactly the causes all the time, but we try to determine it based on the patient's history, diagnosis, observable symptoms, and current medication regimen. I'm going to give you a brief overview of 13 common causes of terminal agitation, keeping in mind it isn't always black and white, and it's often a mixture of multiple factors. What's most important is you call your hospice and they can help identify and manage the symptoms effectively and quickly. 1. Metabolic imbalances. Built-up of waste products in the body like ammonia from liver failure or uremia from kidney failure can affect the brain function and cause agitation. We can treat these imbalances if we know what is out of balance. For instance, if we know or suspect high ammonia levels due to disease such as liver disease, we can give medications to decrease the ammonia in the blood. But keep in mind, we are not pursuing diagnostics and treatments on hospice, but focusing on symptom management and quality of life. Number 2, medications. Certain drugs like opioids, steroids, benzodiazepines may contribute to restlessness that can spiral into terminal agitation. Your hospice will look at your lab and diagnostics and order comfort meds that are least likely to cause adverse effects. A common example of this is people with advanced kidney disease may do better on oxycodone rather than morphine. If a medication is clearly causing an adverse effect, hospice will either stop it or adjust it. 3. Withdrawal from long-term medications like antidepressants can trigger symptoms. As a patient begins to lose their ability to swallow, they stop taking their long-term routine medications. With certain medications like antidepressants, stopping abruptly can trigger agitation. 4. Pain or discomfort. Physical pain and discomfort can often be expressed with agitated behavior. This is especially true for those who no longer can express themselves, where it hurts, how it feels, leaving their discomfort to manifest in other ways, such as restlessness or agitation, and can be distressing. This is common in the dementia patient or a patient who has lost their ability to communicate in the dying process. A very common scenario is a dementia patient with extreme agitation and anxiety, out of control behaviors, and they're prescribed more and more sedatives or antipsychotics, but the real issue is unmanaged pain. I can't tell you how many times we've started just a little bit of pain medication which resolves the source of agitation and then taper off the sedating medications, and they wake up and start eating again and feel better. Keep in mind, the goal isn't to fix them, but in hospice, it's very common that when people feel better, they do better.